going to keep the conversation going, but Dr. Miller, tell me what you were just sharing there about young doctors and their choice of whether or not to go into primary care.
So most of us have inadequate training in how to address substance abuse. So when someone comes and they are doctor shopping, it's very stressful for the physician, especially a young physician, if you don't have the skills to deal with it. And I have learned a lot just on my own since my training. But during that training, the only thing I learned was how to finally identify someone who was abusing my prescriptions and how to discharge them from practice. And yet, we really need to know how to help these patients. So I was really saddened in talking to a number of doctors in training. I was giving a mentorship talk to about 30 residents in internal medicine, and I asked them what would make them hesitate becoming a primary care provider. And as you know, we have a shortage in primary care providers. And a third of them said that a major reason, and these are residents training in Missouri, a major reason why they wouldn't want to go into primary care is because of all the narcotic seekers.
And is that Missouri specific? Are people coming from other states because of the availability?
Yes, absolutely. And you know, with us being in the Boot Hill, we're Tennessee, Kentucky, Illinois, Arkansas. They're right there, and I have a pharmacist who is also a drug task force, and he has arrested someone in his pharmacy before coming across the state line doctor shopping.
You're seeing
Absolutely. We've seen this constantly. And I think one of the reasons is you don't have a system here. We become a little attractive here
and we
in
have
Missouri.
8 states on the border.
And you have multiple states on the border. And we've seen people from as far away as Maryland going to, ostensibly to a physician in Georgia and then driving to Missouri to fill that prescription, which just seems a little bizarre given the amount of pain that these people claim to be in.
Missouri isn't the only problem, though. I think I got this number from Dan years ago. The United States represents 5% of the world's population, yet we consume 99% of all the Vicodin produced for the planet. We have a huge prescription pain problem in the whole country. Granted, Missouri's getting the crutch of it right now without PDMP, but this is a bigger, major issue that needs to be looked at because of that number.
We see a lot of stats like that. I mean, we do the most polluting, we eat the most whatever. But I mean, but do you? But I want to pick up on what you're talking about there. What is our attitude? You mentioned the evolution of prescription drugs. What is our attitude?
Well, a pill will fix anything. And we have to get away from that. I mean, there's a lot of reasons for a lot of great medications helping people, certainly. But we have to recognize when there's a huge downside like this and young people are dying, we have to respond to this. And we can't just keep throwing out statistics and talking about it. We have to take action. So it's policy, it's community education, it's prevention for youth. That's a huge issue that's missing, that we have to do more for kids to prepare them to make good choices for themselves. And we have to have good treatment available when people do get caught up with an addiction. So we need all those things.
Available is the biggest word. Treatment availability, which is almost non-existent for people without insurance, have to go to great lengths to get help, which is a tragedy of this country, that they can't get help.
Let me just say we're going to